Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for liver troubles. Before describing the remedies for liver trouble, let us get the basic things of liver. What is liver? Where is it situated? Dark reddish brown smooth surfaced wedge-like biggest gland of the body. Liver is placed on the right side of the abdomen just below the diaphragm. Stomach, spleen, pancreas and right kidney are placed below it. Liver is directly related to digestive system. It has two lobes, right and left, attached with the caudate ligament. Now let us see the picture. This is liver, beautiful shape. This is spleen, stomach, gallbladder, pancreas. These are all related to liver. So, and this is left lobe, this is right lobe. Why is liver a unique organ? Liver has two distinct and separate blood supply lines. Number one, through hepatic artery, oxygenated blood is supplied to the liver. That is, liver is an organ. It needs its own blood supply, that is hepatic artery. This blood supplies the energy, the oxygen, the nutrients to the liver. Number two, via hepatic portal vein, nutrition-rich blood enters into liver. This is something else. This vein contains blood that is nutrition rich. That is, this nutrition rich blood, this nutrition has been drawn from intestine, where our food is being digested. So that nutrition rich blood comes through hepatic portal vein into the liver. This is the actually supply from food to the blood, from our food to the blood. Each lobe of the liver has 8 segments. In each segment there are 1000 lobules. Hepatocytes means cells of the liver. Lying within lobules produce bile, which along fine ducts go to the common bile duct. C. This is common bile duct. The C is common bile duct. C. Via right and left hepatic duct. Right, left, hepatic duct, common bile duct. Cystic duct drains total bile into the gallbladder. Cystic duct. This is cystic duct. Through this duct, gallbladder, the total bile comes to the gallbladder. From gallbladder, bile is moved to duodenum. Thereafter, it is remains stored. Now, whenever needs, this gallbladder comes back. The same route, but now not going above, but going downwards into the intestine. Duodenum actually, and moves to duodenum via common bile duct to mix with the partly digested food. Liver is capable of regeneration. Many of you do not know that this is the only organ, liver, which is regenerated. That is, if you give a person 20% of liver of somebody, that is liver replacement or liver transplantation. The person's liver is damaged, it is cut out, and then somebody's good liver, 20% portion of the liver is planted. That 20% will be regenerated to 100%. There is no other organ in our body that is capable of this regeneration. What are the functions of liver? Whatever food, drinks we take, the essential nutrients of them are absorbed from upper gastrointestinal tract. Mixed with blood, this nutrient-rich liver analyzes the nutrient-rich blood to produce simpler substances, then process them, toxins are detoxified by liver also. In fact, scientists say liver perform about 500 different types of functions. 500 different types of function. A few main functions are: number one, creates bile containing waste products which helps in emulsifying fat. You know, bile helps in emulsifying fat. Synthesizes plasma protein of blood. Most important, very, very important. If this is not done, the person will not get the proper nutrition from the food. That is, he will eat food, he will eat rich food, he will eat enough good food, but his body will not be improved. Synthesize plasma rich protein of blood. Synthesize cholesterol, convert excess glucose into glycogen and store it in body so that in time of need glycogen is converted into glucose to supply energy. That is another very important functions. We are in particular time, say we are taking too much of food, so now too much of glucose is produced. So glucose too much, if it is produced and it is remain in the blood, that will be some disease, you know, diabetes. But the person is actually good person, I mean he is healthy person. The healthy person's extra glucose will be converted into glycogen and will be stored in the body, so that in the point of time, at need of time, that glycogen will convert into glucose and supply the required energy to the body. Number 5, another demise. After demise of RBC, demise means death. After death of red blood corpuscle, the serum is broken down to store the essential iron of RBC. So now RBC contains a handful portion of iron in it. That cannot be, this should not be wasted. So body has performed some functions of its own, so that the essential portion iron is kept and left portion is broken down. So it is left for reuse. Detoxify ammonia producing metabolism of protein converts into urea. This, you know, this is a very important phenomena. The ammonia detoxified and the urea is produced. Number 7, detoxifies toxic, harmful chemicals or medicine into our body. We take through food, drinks, enough of harmful chemicals every day, enough. Some medicines are obviously harmful. All these harmful things, I mean toxic thing, harmful means toxic, these are detoxified by liver. Liver and kidney, actually these two organs are constantly help us to remain the body toxin free. One is detoxified directly, another excretes. Kidney excretes through urine, and liver, its own action, through his own action, it detoxifies the toxins, generate immune factors and resist infection by clearing out microbes from our body. Another very, very good important. So it generates immune factors, removes bilirubin, waste product of blood from our body, and resist jaundice. This new bilirubin, removal of bilirubin is done by liver. If bilirubin is not removed, then bilirubin stays in the blood, jaundice results. Liver breaks up the toxic materials and puts the waste product either in bile or in blood. Waste product, bile are excreted through stool from intestine, and the waste products of blood filtered out by kidney. That one is directly through stool, that is in intestine, another through kidney, that is through blood. What are common liver diseases? Number 1, viral hepatitis. Viral hepatitis A, viral hepatitis B, and viral hepatitis C. These are the causative organisms. Hepatitis virus A, hepatitis virus B, hepatitis virus C. The name of the disease is viral hepatitis A, viral hepatitis B, C. Diseases caused by modern drugs, different toxic substances, alcoholism, etc., like fatty liver, liver cirrhosis, number 3, liver cancer, chronic and acute liver failure. These are the common liver diseases. Now see the stages of liver disease. Generally, the common stages: healthy liver, fatty liver, liver cirrhosis, liver fibrosis, then liver cirrhosis, and finally liver cancer. That's the final stage that will come later on. What are common signs and symptoms of liver disease? Though signs and symptoms are dependent on the disease, yet the following signs and symptoms are common. Edema of leg, feet and abdomen. See this, edema of legs, abdomen. Skin get bruised from little injury, color of stool, urine changed, stool get whitish pale while urine gets yellowish or dark. This is the signal of jaundice. Yellowing of skin and sclera, itching of our skin, profound weakness, vomiting, nausea. Sometimes no sign symptoms are visible. That is very dangerous thing. There is no symptoms or symptoms, yet that your liver is getting damaged. That is very difficult. Now here is the healthy portion and jaundiced portion of the body. When to consult a doctor? If any 3 sign symptoms from the mentioned above continue for 3 weeks or more, then doctor's advice must be sought. How to confirm a liver disease? There are many tests for confirmation of liver disease, but the following 2 tests are enough in most of the cases. Number 1, liver function test. That is alanine transaminase test, aspartate transaminase test, alkaline phosphatase, gamma glutamyl transferase test, L-lactate dehydrogenase, prothrombin PT, bilirubin, albumin, total albumin. Actually, this is a combined test. All tests are included in this liver function test. So if you get liver function test, you will get all the results. From this result, the status of the liver can be known. And finally, liver ultrasonography. Liver ultrasonography, this is liver ultrasonography, this is liver ultrasonography. One who can read this, from that he can say the liver is in such and such condition. How to prevent liver disease? How to prevent liver? I have given 5 star. Please note that there is no cure of chronic liver disease, so none can ignore preventing liver disease. To prevent damaging liver, observe the following. This is so important that I have given 5 star. You have to do it because liver disease is very difficult to cure, almost no cure. Number 1, change the habit of taking modern allopathic drugs. Following drugs bring about drug-induced hepatitis, DIH. That is, your medicine is creating your heart trouble, liver trouble, hepatitis. All painkillers and fever-reducing drugs, all painkiller and fever-reducing drug that contain acetaminophen. 3 star. This medicine is in the market with so many names, but where it contains this chemical acetaminophen, and their number is about 600. These are available in tablet form, suspension form, syrup form, and various other forms. There are a lot of OTC drugs. OTC means over the counter. Over the counter means you demand, the shop will give you. There is no need of any doctor's prescription. This is OTC drug. And a bevy of PD. PD means prescribed by doctors or medicines. So take care. All this thing cause serious damage to your liver. The names of medicines are given here. Please check it. Double star means continuation. B. Common NSAIDs, non-steroidal anti-inflammatory drug. Something which is also readily available from the counter. Ibuprofen, diclofenac, naxoprene, etc. See, this all causes damage of liver. See others, that is amiodarone, anabolic steroid, birth control pills, erythromycin, methyl dopa, isoniazid, methotrexate, statins, sulfur drugs, tetracycline, etc., etc. There are so many drugs. Actually, your doctor before giving it can say whether this will damage your liver or not, and you can control that up to your need. You can ask whether this medicine, sir, doctor, please tell me whether this medicine endangers our liver, so that I am aware of this thing. The doctor, if you doctor is good, he will say yes, it will have a damage. You please take according to my advice. Don't take without my advice. Number two, control alcohol consumption. Shun completely. Control alcohol consumption and shun completely addiction of drug like cocaine, marijuana, heroin, etc. This, this actually shatters the health of the person whole. The man is going towards his end days towards with if he uses this thing continuously. Number three, resist infection of viral hepatitis A, B, C, D, E. There are 5 types of hepatitis. HIV spread via contaminated food. That is hepatitis A, hepatitis B, E. These are spread through contaminated food, drinks, and P2P, the person-to-person contact. HIV vaccine is available in the market. Those who have much probability of attracting HIV should take the vaccine at the first instance. That is, if you're in your family there's a history of hepatitis, or it is you know that some of your forefathers or near relative died of these things, you can take HIV vaccine previously before anything. To resist infection through food, drinks, observe general health practices strictly. That is, general health practice means washing hand and taking care of various things. HCV, HDV infection spread via infected blood, all types of sexual contact, vaginal, rectal, oral. This produced chronic hepatitis. This was through the person-to-person food, drinks. This directly actually sexually transmitted. HV vaccine is available. This vaccine is HIV means same type, HIV, HBV vaccine available. Potential subjects should take as early as possible. Observe healthy practice to stop infection via blood fluid. That is, he has to be careful about this sex matter in case of B, C, D infections. Some vaccines images are given here. Number 4, keep body weight under control. Another very important thing, obese persons are predisposed to get affected with fatty liver. From excess fat in the liver, to start with, no serious sign symptom is seen. To start with, there is no serious symptom, but unless it is told in time, liver gets gradually fibrosed and ultimately cirrhosis result. That is, one cannot know until cirrhosis comes. You have to be careful before that. It's a definite fatal disease. Cirrhosis means almost your life is gone. Almost gone. So controlling weight is a very important preventive measure. The steps is like this: normal liver, fatty liver, liver fibrosis, liver cirrhosis. This fatty liver and fibrosis, many times this is silent. This is silent. There is no prominent symptoms. But you know that you are taking some dangerous thing, there is alcohols or other something dangerous for you. But you are taking it, but you feel that I am okay because there is no symptoms. But actually, then from normal liver, one day you will certainly know that your liver is cirrhosed. That is almost damaged. You have damaged your liver. There is no symptom. It happens, but it gives some symptom. Then you should take care at that time, right? Otherwise, don't take those things which I have mentioned previously, those dangerous things. Avoid this, because mind it, one question is asked to a doctor, sir, what is the function of liver? Liver, doctor answer, liver, if you want to live more, then you have to depend on your liver. Liver, if your liver is good, mind it, if your liver is good, there is a good chance that you will be healthy for a pretty long time. Of course, there are other viscera also, heart, lung, brain, everything is important. But liver, what you eat, what you drink, what you consume, the nutrient from that portion is extracted by liver. So if liver is good, then from extraction from food, nutrition is good. So there's every chance that you will be maintaining a good health for a long time. Now the remedies. Calamure for liver disease. Jaundice. Wherever number is given, it is related to picture. Please note it. Jaundice, picture 1. Pain in hepatic region, tongue with white or grey coating. Tongue with head coating, jaundice. Constipation. Coating stool light yellow. Constipation, piles. In absence of other specific symptom, if tongue symptoms and jaundice are there, this is used almost as a specific. That is, calamure is a very good medicine for liver diseases. Fluoric acid for liver diseases. Ascites from hepatic induration, portal congestion owing to alcoholism. When ascites are come, it means that the liver has damaged already a lot. Craves refreshing drinks, hungry always, feeling of fullness, pressure in the epigastrium region. This region is called epigastrium. This region. Epigastrium 3. Constipation, piles with scanty fetid dark urine, skin shallow, sleep disturbed. These are the symptoms of fluoric acid. Subject's cachectic. Cachectic means he is going thinner and thinner. His body weight is losing and losing. Flabby, broken down. Always feel too hot. Likes to bath with cold water. Despite broken down condition, work hours after hours without fatigue in cold or hot weather. That is another very interesting symptom. The patient is going down his health, but he has the capacity to work without fatigue, whether it is in cold or hot weather. This is the peculiarity of fluoric acid patient. Netamure for liver diseases. Malarial cachexia. That is cachexia coming from malarial infection. Cachexia means thin, very thin body. All the muscles, fat is gone. Only skin and the bones. That is cachectic picture. Dull, heavy aching about liver after eating. Worse as digestion progresses. Skin yellow, earthy. Stitching pain in liver. Spleen worse from every motion with obstinate constipation. Mapped tongue. Subjects like to stay alone. Avoid fuss. Don't like consolation from others. This is general symptoms. Either tend to take free salt or avoid salt altogether. The underlying symptoms are always general symptoms. That is the picture of the patient himself. It is not of the disease. This is a symptom of the patient. If it matches, if this symptom matches, then medicine will act very nicely and positively, because the first portion of the symptoms are always disease symptom. The underlying symptoms are general symptoms, the patient related to the person. Netem sal for liver disease. Jaundice from vexations. From excessive mental work. Soreness in liver with sharp stitching pain. Tongue greenish yellow or brown. At base, shallow, yellowish fish. Vomiting of bile worse lying on left side. Subject drowsy, worse in forenoon when reading. Suicidal melancholy worse from music in morning. Stools dark green, bilious. Urine loaded with bile worse in damp wet weather, better in warm dry weather. Same thing, these are general symptoms relevant to the person himself. Cachexia for liver diseases. Abscess of liver. Hard, tender with beating, soreness or throbbing. Abscess of liver, hard, tender with beating, soreness or throbbing. Ulcerative pain in liver. Worse from motion, touch. Lying on right side. Burning or throbbing in the pit of stomach. Pit of stomach means this portion. Just beneath your sternum bone, the breastbone and sternum bone, same thing, technical term is sternum. There is a pit. That pit is called pit of the stomach. Aversion to warm food, desire only for cold things. This is the characteristic of silesia. Painless diarrhea with exhaustion or constipation from inactivity of rectum. Subjects very chilly, lack vital heat, wants to dress with warm clothing even in summer. Often they are cachectic, lack physical mental grit, skin unhealthy, little injury, festers, that is causes pus. Discharges are thin and offensive. General symptoms. Sickle core for liver diseases, acute excruciating pain in hepatic region. This is, this is the liver. So the chest area or abdominal part that is in contact with this thing is called hepatic region. Tongue coated with a thick brown tenacious substance. Thick brown tenacious substance. Inflammation, enlargement and gangrene of liver. Burning in throat, unquenchable thirst. Great weakness, limbs cold, covered with cold sweat. Argentum nitricum for liver diseases. Cirrhosis from malarial cachexia. Previously, we have also taken one medicine that is also from malarial cachexia. It is possible. There may be more than 1, 2, 3, 4 medicines that all relevant to the cachexia of malaria, but the totality must match before giving. Just from one thing you cannot take a medicine, give a medicine. Peculiar fullness in liver, occasional drawing and stinging pain, especially when walking, sometimes reaching into chest. Periodical dull stitches in anterior surface of liver. Hepatic affection resulting in fetal dropsy. That is hepatic affection followed by fetal dropsy. First hepatic affection, then dropsy, that is edema comes. Subjects very nervous, great apprehension when getting ready to keep some appointment. Diarrhea starts. This is argentum nitricum patient. They are very nervous. While you have to keep appointment, he is getting ready. Then just before leaving his room, he feels some urge from diarrhea. That is nervous diarrhea. They feel chilly when uncovered. Again feels smothered when he wrapped up. Crave sweets, sugar, salty foods. Alumina for liver diseases. When stooping, liver pains as if bruised. Stitches which when rising again. Tearing pain from liver to hip with stitches in both hypochondria. Now what is hypochondria? Note this. This is the abdomen, or rather abdomen pelvic region jointly. These have been divided into 9 quadrants. This 9 quadrant, 1, 2, 3. This is right hypochondriac region. This is left hypochondriac region. This is epigastric region. Now this is called hypochondrium, hypochondria. This is epigastric region. This is right lumbar region, left lumbar region, umbilical region. This is near navel. Right iliac region, left iliac region, hypogastric region. These are technical terms. You must know this thing, because if you practice medicine, you have to know this thing. So, tearing pain liver with both hypochondria, worse from motion. They feel time passes too slowly. They means the pace persons. These are general symptoms are coming. They are very hasty, hurried, very sad with variable mood, seeing sharp instruments or blood, impulses come to kill themselves.